I want to wish everyone a good afternoon and welcome to our California Seniors Deserve the Master Plan for Aging, which is I proudly brought to you by CARA, California Alliance for Retired Americans, and by St. Barnabas Senior Services. And I want to also just say a personal shout out to my colleague and peer Jodi Reid for her, shout out for her leadership and her team and helping to plan this event, and also to the St. Barnabas team. We're really proud to be able to bring this event to all of you, where we're turning the work that's been done on the master plan for aging into what Jodi likes to refer to a public conversation. So bringing it to all of you so you can actually really get a benefit of understanding and knowing what's in there and what that means for you and your lives. And before we get into an overview of the event in front of us, I'd like to introduce to you Cynthia Lopez, who's with CARA, and she's going to explain the translation interpretation services and along with some other specific details. So I'm Rigo Saborio, and I'm president and CEO of St. Barnabas Senior Services, and I'm going to be your humble moderator today and slash master of ceremonies. And I'm going to be doing my best and also trying to pace the conversation as we've noted. This is all going to be translated into Spanish as well as Korean. So this is exciting. And again, this is an attempt by through the partnership of CARA and St. Barnabas Senior Services to bring the conversation to you where the rubber meets the road and really where life happens and where it's supposed to really truly where the magic happens, I should say. And so let me share with you a little bit about what today's agenda looks like. So let me go ahead and introduce this wonderful list of presenters. We're going to kick this off today with Fernando Torres-Gill. He's a UCLA professor. He's going to lead us through the overview of the master plan for aging. And not only is he a professor, he's been a stalwart leader in the field of aging, not only nationally, but internationally. So it's a pleasure to really have him with us. And then that's going to be followed up by covering the top 5 goals of the master plan for aging. As you may know, there are 5 goals, bold goals that we call them, that were identified, and from that stems 23 strategies and over 100 initiatives. Clearly, we're not going to have all the time in the world today to go through all of them, but we're going to touch on some of these so you really get a good understanding of what's in there. And that's going to be kicked off by Patti Prunhuber. She's with Justice and Aging, who's going to tell us about housing for all ages and stages. And she'll be followed by David Lindeman with UC Berkeley, who is going to talk to us around inclusion and equity with a focus on technology and the digital divide. And he will be followed by Brandi with SEIU 2015. She's going to speak to us on the goal of health. And then we're going to have special remarks, still touching on the context of the health goal, by the Honorable State Senator Maria Elena Durazo. She's going to be touching on the expansion of Medi-Cal for undocumented adults. She will be followed by Dr. Donna Benton, faculty at USC and the director of the Family Caregiver Support Center at USC and the LA Caregiver Resource Center. And she's going to be talking about caregiving that works. And we're also going to have Janny Castillo with St. Mary's Center, who's going to be talking to us about the 5th goal, which is around affording aging. After that, I'm sure there's going to be quite a bit of information at that point that you have to digest, and we'll probably need a break. So we're going to take a stretch break around 12:40, 12:43 around that time, and then come back for a Q&A when Susan Meyer of CARA is going to lead us through that. And then the treat, last but not least, is we're going to hear from CARA's very own leader, Jodi Reid, and she's going to advise on making the MPA a reality and really go through some next steps, things for you to think about and to take some action in. And then, of course, we're going to wrap everything up on a highlight. So if you got inspired by sort of the first musical that we showed today, we're gonna leave you all with a little dance, and hopefully you get your groove on with the Macarena dance. And so we'll wrap it up with that. And of course, and that's so at this point, I'm sure you've heard enough of me, but it's a pleasure to have you all with us. And without further ado, I'm going to turn it over to my colleague and dear mentor, Dr. Fernando Torres-Gill. Fernando?
Thank you, Rigo. I hope you can hear me well. And let me commend St. Barnabas Senior Center and CARA for this tremendous leadership and bringing us all together. And I'm honored to set the stage for what I believe is not only an innovative approach to preparing for the future, but a model of what the rest of the country should be considering and actually doing. And that's preparing for a state that is growing older and is quite diverse. And we have to thank Governor Newsom and the state legislature for having the foresight to ask themselves, how do we prepare California for its demographic changes where all of us, regardless of age, ethnicity, ability, sexual orientation, or circumstances, will want to grow older here in this amazing state? And in that motivation, the governor brought together a stakeholder advisory committee, a group of about 30 individuals. Many of them are here with you, including Jodi and Rigo. And they presented a challenge. They reminded us that California is changing. We have the largest number of persons 65 and over. We all have the potential to live a good long life. But California is now diverse, majority minority, where all groups, whether they're African American or Latinx, Hispanic, Asian Pacific Islanders, Native Americans, immigrants, European, Jewish, California is now the future of the nation, a diverse majority minority state where we all want to live a good, long, healthy, and happy long life. Yet, the Master Plan on Aging, which was our efforts to prepare for those changes, also recognized that there are many challenges. There are many disparities. Not all of us have equal opportunities to have a safe, secure place to live in as we grow older, to have access to health and long-term care, to be able to save for a long life. Not all of us have those equal opportunities. And I believe that's one of the great opportunities of the Master Plan on Aging. And you'll be discussing in great deal at least 5 of the goals that bring together the many recommendations. But California is now moving forward. We are leading the state in planning ahead. Let me just say this much. Get to know the many details of this master plan on aging for all of the hundreds of participants here, because it is not an academic report that will stay on the shelf. It's not a policy analysis for a bunch of intellectuals. It is designed for all of us at all stages of life, but also all of us, whether we're involved or not involved, aging or younger. And it's something that is going to be operationalized. It has a very active, committed goal to work directly with the legislature and the governor's office to make sure that many of the priority recommendations actually occur. And you're going to be hearing about many of them. But I'd like to leave you with a few key themes, which I believe will inform your discussions. The first is we injected into our planning, and it was a year-long effort of the group that involved many stakeholders from all sectors, from the public to the private, the unions, the academics, industry, corporation, the governor's office, etc. But we all recognize that in planning for aging, it's not enough to plan just for those of us who are now elders. or older Californians. I'm 72 years of age, but it's not just for those of us that have reached that wonderful stage in life. It's also to prepare younger groups, the lifespan perspective. We now know that what we do for younger groups will enable them to have a far better chance to grow older, healthier, and in better circumstances. And therefore, it's about working as well with our diverse younger populations to give them that opportunity to enjoy that long life. This report also ensured that there was an equity lens, that we take into account the racial disparities, the ethnic disparities, the many challenges and barriers towards a diverse population having equal justice, social justice, and an opportunity to enjoy this culturally diverse population. So we are excited about the future. Already there are efforts to ensure that many of the recommendations are put forward. One area that I know Justice and Aging and many of us are working on, one of the key reports is to ensure we have leadership in the governor's office. And we're hoping soon the governor will announce that we'll have an individual to oversee the process. Many of our members on the stakeholder advisory group are now ambassadors, liaison to key state agencies, each of which have a direct responsibility for a segment of those recommendations. So all of us have an opportunity to be active, to be leaders, to be advocates, to use this master plan on aging as our tool to ensure that we not only prepare for a good, healthy old age for ourselves, but we do so for other communities and all age groups so that we can want to live and grow old in this amazing state. So it's my pleasure to set that stage, to remind us that California is undergoing tremendous demographic changes, but we welcome it, and we believe that as we plan for aging with this amazing document that is going to be active in reality, that it will show the rest of the nation they need not be afraid of diversity, of ethnic and racial groups, of large populations of older adults, and in fact, that is what will truly make the United States great, as it's going to make California great. So with that, I thank you and look forward to the rest of the conference, and the real experts are going to be speaking to you on the many different recommendations and the 5 goal areas. Thank you, Rigo, and thank you, Jodi.
Thank you, Fernando. Always a treat to hear Fernando. He's extremely busy, so really appreciate him making time to be with us today and to really share his thoughts and really paint a portrait of what the master plan is and what it means for Californians in the coming years. And so thank you, Fernando, for setting that context and for motivating us, quite frankly, to call, as you know, for a call to engagement. And so really looking forward to have all of us engage in the implementation of this master plan. Now we're going to really take that deep dive into the 5 bold goals. And we're going to kick it off with the first goal, which is around housing. And we have a wonderful expert with us in that area today. Patti with Justice and Aging is Patti Prunhuber with Justice and Aging is with us today to share her thoughts, perspectives. So Patti.
Thank you, Rigo, and thank you, Fernando, for doing such a great launch of this. I'm going to try to share my screen right now. I'm being told I've had it disabled. Is there a chance that I could share my screen for some slides? Let's see.
Patti, you should be able to share.
Yeah, I think we got it. Let's see. Can you see it, everyone? Should happen, yeah? No?
Yes.
Great, okay. So I am really delighted to be joining you today to talk about the housing goals in the master plan and the opportunities for all of us to take action in support of age-friendly, affordable housing and to put an end to senior homelessness. Some really brief context for this conversation. Older low-income adults are at the center of California's crisis in housing unaffordability and the surge in homelessness. And older adult renters are more likely to pay a very high proportion of their income for rent than the younger population. And this extreme rental cost burden places them at increased risk of housing instability and homelessness. I know you all know this. Due to a lifetime of discrimination, these extreme rental cost burdens and risk of homelessness fall disproportionately on Black, Latinx, immigrant, LGBTQ, and other marginalized communities. And older adults are the fastest growing segment of our homeless population. Our 65 and older neighbors are expected to triple the number who become homeless between 2017 and 2030. And these same racial and ethnic disparities show up in the incidence of homelessness in LA, where Black people are 4 times more likely than a white individual to become homeless. So that's the bad news. We then, as has been explained, engaged in a very robust process to develop the California Master Plan with its 5 goals. And while housing wasn't initially mentioned in the governor's order creating the commission, it came out as the first priority: housing for all stages and ages. And I think that's a measure of how much housing has become in the forefront of our agenda and our concerns in California. You've heard about the stakeholder process. Now we have this goal: housing for all stages and ages. We will live where we choose as we age in communities that are age, disability, and dementia friendly. And I want to just read you the words from Secretary Lourdes Castro Ramirez, who is the head of the Business Consumer Services and Housing Agency that will oversee a lot of the housing goals. She said, "Housing is essential to our ability to age where and how we choose with dignity. We must ensure that all Californians have access to safe and affordable housing options that meet our needs at every stage of life." And I'm thinking that maybe these slides will be shared with you at the end. I've given you a link to the housing goals and initiatives in particular at the bottom of this slide, or perhaps it could be copied and I'll put it later in the chat. So what is it that we hope to accomplish? First, we're talking about affordable housing for all. And that means that we have 11 housing initiatives, and then another 3 initiatives that will show up in affording aging around homelessness and ending senior homelessness. And that they cover everything from looking at ways to increase the production of affordable housing, to changing tax credits, to targeting subsidized housing towards the lowest income households that will never be able to afford market housing, to creating permanent supportive housing, which is housing with services wrapped around, shared housing models, and combining housing with an increasing scale of supportive and health services. And I think the important thing is that there's an idea that there's a continuum of care that people are going to want, and that people have expressed very strongly their desire to age in their communities as much as possible. And what Fernando said about that it's not just for older adults, it's that we want intergenerational thriving communities where people can age well. So in the area of homelessness, I want to just focus on 3 initiatives. And one talks about during the pandemic, we had Project Room Key to create safety for individuals experiencing homelessness by putting them in motels. Out of that grew Home Key to create interim housing and to further develop that network of housing to end and prevent homelessness. And then the next initiative, expand older homelessness programs such as Home Safe, and then in parentheses, Adult Protective Services. And it mentions some other programs. It's Home Safe and Adult Protective Services that is one of the legislative bills that I'm going to describe to you in a moment. And then the other initiative, and this is a very important way in which health and housing are being combined, is to look at ways to create in-home supportive services where people can get help with personal care and daily activities right in their home without having to go unnecessarily into a nursing home or other institution. So the bill that I'm going to talk to you about is Assembly Bill 695 that's authored by Assembly Member Arambula from the San Joaquin. And it takes the Adult Protective Services Program, which is a program that provides services to older adults.
We can't hear you.
Did I just disappear?
Oh, you're here. You're here.
No, I can hear you.
We can hear you.
It's fine.
I can hear real
Everybody
well.
on? All right.
You have a good headset.
So the Adult Protective Services Program protects people and provides services who are either victims or at risk of abuse, neglect, including self-neglect or financial exploitation. And any one of these things can put people at risk of becoming homeless or even experiencing homelessness. The bill would expand the Adult Protective Service Program by lowering the age eligible for services from 65 to 60. There we go. And it would also allow for longer, more intensive case management, recognizing that it often takes more time to deal with the complex needs around homelessness, failing health and disability. And then finally, through the Home Safe program, which is the one focused on housing, provide money for rental assistance to prevent homelessness. This has been very effective around the state to keep elders housed and to pay for accessibility modifications so that somebody can stay in their home, or for help obtaining housing if somebody has already become homeless. I think there's a fact sheet that you have that describes the bill also in a little more detail. I just want to briefly sort of say what it is that we can do here. I look at the master plan for aging as the door, not the destination. Many of the goals are written in broad language and the initiatives are more exploratory than concrete. They might say, identify solutions or consider the feasibility of. And what we want to do is turn these into action plans. And so I think that's where you all come in being able to do that.
Thank you, Patti. We're close to time.
Okay, I'm just gonna very briefly say, you have the master plan of aging, use it as your tool to focus on older adult issues. We know that COVID has made that more pressing. Engage with advocates statewide, but at a local level, you really know how to do that as well. And there's going to be a lot of local data that you can use. And there is a data dashboard. And adopt an agency or an initiative as your own. As Rigo said, there are over 100 initiatives. Pick one that you really care about and bring it to life. And look at the money in the American Rescue Plan. Thank you so much.
All right, well, thank you so much, Patti. That was an incredible presentation and such an incredible job in the short time that we have. There's so much in there, but you really hit on some of the key highlights. And of course, there's going to be opportunities for follow-up. If not today, we'll find a way to connect and bridge the audience with the speakers today. We can get to all your questions. So no worries, everyone. It's important, though, that you really get a good basic understanding of what's in each of these goals. And next, I want to take the opportunity to introduce to you David Lindeman with UC Berkeley. We are certainly very excited and thrilled to have him with us. He's an incredibly sought after speaker, a leader in this space of with regards to inclusion and equity around technology in particular. So with that, David, welcome.
Thank you, Rigo and Jodi, and again, Fernando, for that wonderful introduction. It's delightful to be with you today and to share with my colleagues who were involved in developing the master plan for aging additional information for your consideration, because we clearly see the opportunities for moving forward using this, as you just heard from Patti, and you'll hear throughout the rest of the day, the importance of a 10-year plan, how we will need to move forward in so many areas, and particularly in inclusion and equity, the basic fundamental philosophy and a filter through which we need to look at all of the ideas that are coming forward. The Master Plan on Aging put forward a very large range, a number of ideas. And before moving into it, let me not only thank CARA and St. Barnabas for putting this on, but back to the folks at the state, not only our governor and the cabinet who have embraced this area, but the director for the California Department on Aging, Kim McCoy-Wade, who is a champion for us in this area. And without this, many of these ideas would not be able to move forward. So very quickly, I would like to take you through what is a very vast area of different issues. And as Fernando started us, making sure we understand the vast diversity, but yet the inequities that occur not only for older adults, but across our society are front and center to what we need to address. And this is only going to be even more rich and important an issue as we move forward. So again, this is an audience that knows this area. I won't speak to it, but again, we are going to see not only by 2030, but going forward 2060, the wonderful richness of our society. But to make sure that older adults do well within this environment and do better, we have put forward a number of areas and ideas. And this was identified as goal 3 of the master plan: inclusion and equity, but not isolation. Because as you can see in front of you, this involves a whole host of areas, not only from being in the workforce, but to volunteering, lifelong learning, being engaged, and again, how we address some of the issues that Patti started pointing out, reducing abuse and neglect, make sure we avoid discrimination. And as we've seen through the pandemic, how do we reduce isolation? It has only been brought forward in a terribly real manner for us, more than we've ever seen. So goal 3 came forward with how do we improve life satisfaction as we age? And as you'll hear today, each of the goals had multiple strategies. I don't need to read them to you, but from inclusion and equity to the digital divide, workforce volunteer, and abuse and neglect, these areas each had a very specific set of initiatives involved. In fact, inclusion and equity itself had 30 different initiatives. What Rigo suggested we do is just dive into one, which I would like to focus on since I'm at the Center for Information Technology Research in the interest of society, the specific issues around technology that underpin or become a connectivity for so many things as we go forward, and will only become more important in the years to come. Very quickly, just to make sure, for those of you who haven't tracked, and I know we probably have a lot of very savvy digital folks on the in technology, comfortable individuals on the call today, you're all using Zoom, but again, that's not available to so many older adults throughout our society. It's not only because so many folks cannot afford getting technology, but also digital literacy and understanding it. And there are definitely issues in terms of racial and ethnic disparities in what people have. And this is a central area, as you can see from our colleagues at the Older Adults Technology Services have pointed out that this can underlie and both help us address health disparity issues, but also be able to move us forward in terms of reaching people in remote areas, reducing that isolation, and connecting us all. So in this regard, I want to share just one model that we have pushed forward that really helps show you how this can be addressed. And what we have done just since the pandemic, a collection, a collaboration of private and public groups from our California universities, major senior living organizations, Escatan and Front Porch, even our policy centers, the National Center for Connected Health Policy, but a number of private companies all coming together to start tackling this issue, particularly the digital divide for individuals who do not have access through either income or, again, just access to technologies. And we have been working on a very specific targeted area to reach people in affordable housing. And to do that, we're looking at how do you put together a public-private partnership to improve not only getting technologies to a person, but digital literacy. And this goes well beyond affordable housing, as we'll talk about as I wrap up, because it's clearly across our society, it's across all of the different goals you'll hear today. And it's really critical that we put together holistic approaches that will help everyone take advantage of technology. The Lighthouse program that we have stood up is bringing together not only hardware and software, making sure we can get broadband and internet service in an affordable way to individuals, making sure people are engaged and share what they need in terms of technology, not just what a healthcare provider or a technology company suggests, but also getting that technology to individuals and helping people make sure they can use it appropriately and thoroughly. And one of the things we'd like to reinforce going forward is the idea that it's not just getting technology, as all of us know, it's being able to maintain that and going forward. So how does this translate into even more on our master plan on aging? Well, inclusion and equity has a number of strategies, as I mentioned, over 30 initiatives. And I want to make sure that we do justice to those very briefly. But I'll look at strategy B, because closing the digital divide, we actually have an amazing opportunity to work with the governor's executive order on broadband to bridge the digital divide. And this goes well beyond older adults. The key issue is we need to be looking at broadband as a utility, one that will connect us, because it not only addresses engagement, healthcare, even transportation, all different ways to bring people together, but it will be the underpinning for so many of the different initiatives and approaches to working with for older adults to stay engaged, stay in the workforce, et cetera, as we go forward. So I would like to wrap up and just share with you each of a few of the other areas, because it's critical to see just how broad the master plan on aging process has been, how many initiatives you have available to you, because it is not just a technology approach, or as Patti so wonderfully shared with us, a housing approach. There are so many places where we can take advantage of this. So again, there are a number of efforts going forward from goal 3 on inclusion and equity related to how we shape and have people understand the need for equity in aging and ways we communicate that. In terms of the workforce, we have state initiatives, Future of Work State Workforce Plan, that have been put forward, how to allow older adults to stay in the workforce or come back into the workforce, and even how we need to change with assistive technology so we can all be productive. Volunteerism, and this goes much beyond Californians for All, AmeriCorps, CalVals, because it gets into intergenerational work and lifelong learning. And finally, as Patti very nicely was speaking to, we cannot forget the key issues around protection of abuse, neglect, and exploitation. And one of the wonderful initiatives put forward is to champion a California Elder Justice Council to support our wonderful ombudsman and adult protective services programs. You'll hear more about, as we talk about this today, how we can work with leadership in this area, but I'll just reinforce Patty's point. There are so many ways you can become involved. We really look forward to you finding that initiative that works for you and really moving forward. And again, for those who would like to work in the technology space, and I see a number of you already on the call, I would be delighted to work with you as well. So with that, I will turn the program back over to Rigo.
All right, David, thank you so much. So much to cover, and much appreciate you bringing in the key elements to light, and in particular, I think both of you and I know there's such a struggle around, but a great number of older adults around being able to not only access technology and afford the broadband and internet, but the issue also of skills needed to be able to navigate the internet as well as use the appropriate devices. So it's great that I think that you emphasize that the plan brings indicates the need, that need of skill training, access and to affordable quality devices as well as internet. So it hits on all those three major areas. And then again, to your point, obviously that's where we emphasize within equity and inclusion, but it's a much broader goal than that. And we are diversifying in California. So this is an important time to really prepare well for that reality. Thanks again, David. And now we're going to move forward, and we're going to actually touch on goal number 2, which is the health reimagined. So we kind of went a little bit out of order, but so now in terms of how they're listed in the master plan for aging document, let's bring in Brandi Wolf with SEIU 2015, who's going to touch on the health reimagined. And then following her, we're going to get some special remarks from Senator Maria Elena Durazo. But let's go ahead and start. Brandi, if you don't mind.
Sure. Hi, everyone. Really glad to be with you all this afternoon. I am going to talk about a specific recommendation that is noted in the Master Plan for Aging, but under the context of Health Reimagined. I do want to start out by saying what I'm going to cover today is in no means replacing the need for us to, and the state to, address stabilizing the funding for long-term services and supports today. So we know that the in-home supportive services program, IHSS, for example, is set over the next decade to service over 1 million consumers and to cost over $25 billion annually of Medicaid money. That is not sustainable. We need to address funding stability and program stability for our existing long-term services and supports programs. But simultaneously, we also want to think about health reimagined and long-term care reimagined in our state. So the health reimagined goal really is one that wants to guarantee access to care and services that we all need to optimize our health and our quality of life in the setting of our choice, which is of critical importance. We know that people want to age in place. And as we think about this, and not only how we're addressing the growing demands in the existing LTSS system, we want to be thinking innovatively about ways to address what I think of as sort of the sandwich population. If I may use a personal example, my parents have worked, my dad is a sales rep for a small paint company. My mom worked at Safeway for 40 years, and they have worked very hard and have very little retirement, even though my mom worked a union job. Her pension doesn't necessarily pay an above living wage. So when I think about my parents and their potential needs for long-term care, it worries me that if my sister and I couldn't take care of them, they would spend down all of the resources that they have worked their entire lives for, eventually to qualify for IHSS. because they cannot pay the $25 to $40 an hour in private pay home care. And so in 2017, taking the lessons learned from the Coordinated Care Initiative and CalMedi Connect, which are programs at the state level dealing with the Medicaid and Medicare populations, taking lessons learned from that, an alliance of about 20 organizations spanning the long-term services and support system came together to form the California Aging and Disability Alliance. We have worked together since 2017 to work towards implementing a long-term services and supports benefit in California. We know that long-term care insurance isn't necessarily an option for many in California, given the high premiums. And so we've really been working towards the creation of a long-term care benefit. In 2018, we worked as an alliance to get some money in the budget to add questions to the California Health Index survey, or known as the CHIS survey, to ask Californians their needs for long-term care and to have that long-term care lens added to the questionnaire. In 2019, the Alliance worked towards getting some money in the budget for an actuarial analysis. What is a viable, affordable benefit for Californians to receive? Some models in other states, there's Hawaii and Washington, they have a limited benefit that can be used either for respite care in Hawaii or as a long-term care benefit in Washington state. We really want to work towards a broad-based benefit that can be used by many Californians. So we are now, the Alliance is now working with Senator Pan's office and Assemblymember Nazarian's office, and we are lucky enough to work with their awesome staff, Liz Fuller in Assemblymember Nazarian's office and Bernadette Sullivan in Senator Pan's office to move Senate Bill 515 and Assembly Bill 911, which are identical vehicles, identical pieces of legislation that would establish the California Long-Term Services and Supports Benefit Board. So this bill is really just the creation of a board within the state treasury that would administer an eventual benefit. That is the piece of legislation we are moving now. The work that remains to be done is to define what that benefit would look like, who qualifies for it, age, assistance with activities of daily living, those types of things that would be an affordable benefit, and also how we're going to pay for it. We know that being solely reliant on private pay or long-term care insurance is not a viable option for all Californians. And we know that not everyone is able to spend down or wants to spend down all that they have worked their lives for to qualify into the Medicaid system. Just to recap, I see this popped up in the chat. The bill numbers are Senate Bill 515 and Assembly Bill 911. So we are working on these bills. This bill is the first step to create the benefit board, and the Alliance is continuing to work on the development of what the benefit would look like and how it would be funded. So we are excited and really eager to continue the work that the California Aging and Disability Alliance is doing so that we can really work with the state to create a benefit that all Californians could draw down from and receive care in their setting of choice. And so I know I'm almost at time and we have a very esteemed speaker next. So I will stop there and pass it back to you, Rigo, I believe.
Yes, thank you so much. Really appreciate that, Brandi. And we are now going to hear next from get some special remarks from a very special speaker, the Honorable State Senator Maria Elena Durazo. And she's going to be touching on the expansion of the Medi-Cal program for undocumented adults. So with that, it gives me great pleasure to have Senator Durazo be with us today. Senator?
Thank you. Thank you very much. And to St. Barnabas, Rigo, thank you for all that you do and your collaboration with CARA to put this forum on. And just in the short while that the presenters have made their presentations, I've learned so much, and very, very grateful for all that you do now with this master plan. So thank you, thank you, thank you. I'm going to zero in on one very specific piece of all that needs to be done for current seniors as well as our future seniors and living a full life. And that's around healthcare for undocumented. I've been proud to work with Coalition. I'm sure I know you've been helping, but with Health Access and the California Immigration Policy Center. My Health for All Seniors bill will expand Medi-Cal to access to approximately 30 to 35,000 undocumented seniors ages 65 or over, making less than $17,000 a year. Okay, and they would qualify for the program were it not for their documentation status. And we know that we've done an incredible job with the rate of uninsured going down to just under 7% in California. But undocumented Californians are pretty much excluded from accessing healthcare programs. They're not even allowed to participate in Covered California. 90% of undocumented California adults remain uninsured. I'm proud that we were able to win 0 to the age of 26 undocumented, but we have a long way to go. And of the over 2 million undocumented, 1.5 million are uninsured. They are shut out because they work or have worked for industries that do not provide health insurance. They work in low-paid industries. They're essential industries. They're farm workers. They're garment workers. They're domestic workers. We could go on and on, all the essential work that they do. But they are only eligible, as you all know, for emergency services and pregnancy care. So that doesn't cover preventative care for conditions like asthma, diabetes, or heart condition. Only emergency rooms. And that's to the point where their healthcare gets to a crisis. So that's no way to treat people. Men and women who have worked their whole lives, they've raised families, they've paid their share of taxes, contributed to the prosperity of our state and our country. They pay over $3 billion in local and state taxes, yet they're excluded from our safety net programs. Let me just tell you a quick story. Mr. Vargas, a 76-year-old gentleman, collects recyclables to provide for his and his wife to survive. No way that they can afford any kind of health care. Dulce Garcia told us of her father held off from going to a doctor when he broke his arm for fear that he would lose his job and or cost his family already in a difficult economic situation, wouldn't be able to pay for the cost. He opted to make a homemade split in order to continue his work. So we need to expand health coverage to everyone, but the next step should at least be our undocumented seniors. Almost 2/3 have lived in the U.S. more than 10 years. It's time to cover them. And during this pandemic, we heard a lot about the vulnerability of our seniors, the vulnerability of that Latinos have. And the combination of the two has brought the most at risk in our state to enormous numbers. 46% of deaths in the state were Latinos. And 39% of the deaths were Latino 65 years or older. These are not statistics. They are Californians. They are human beings. There are men and women who contribute. And the cost of doing nothing is far greater than the cost of the coverage in dollar terms. Our healthcare system is going to work best when all Californians have access to preventative treatment. And this public health care crisis is not going away unless we provide health care services for our most vulnerable. So I'm asking you, help me pass SB 56 so that we could take one very significant step forward for our seniors, for our most vulnerable, and for Californians. Thank you very much. I appreciate all that you do. Gracias.
Mil gracias, Senator. We really appreciate you being with us today and really touching on this incredibly important issue. Certainly speaking from St. Barnabas' point of view, we serve a highly populated immigrant community. And so this is a very important issue to us and hits at the heart. So thank you for championing this cause and for bringing the issue to us and to sharing that. As part of the, it also strikes at the heart, not just around health, but clearly around equity and inclusion goals as well. We welcome, we hope that if your time allows, you're welcome to stay longer. There'll be a Q&A time perhaps later that there might be some questions, and not you, maybe your staff person. But certainly thank you again for being with us today.
Thank you. Thanks very much.
And Brandi, again, thank you for your comments around this issue. Need to keep the time moving, so I apologize. We don't have any time for additional remarks on that, but let's move on then to like to bring in Donna Benton with USC. She has been in the field in caregiving for over 2 decades and one of the premier leaders in this area, in this space. So I'm so happy and to have her with us today. Donna.
Thank you very much. And good afternoon, everyone. I know we've been sitting a while. We're almost at that break. So I will just want to talk about something that impacts us from the time we're really born. How many of us really think about ourselves as family caregivers? We probably don't think about it because usually when you hear the word caregiver, you think more, oh, that's probably somebody who gets paid to help someone else. But actually, caregiving is something that starts throughout our lifetime. We think of, our parents are our caregivers. And then we probably have somebody in our family, or you might even be doing right now, where you think, Brandi said, if my parents didn't have my sisters to care for them, they wouldn't be able to afford long-term care services and support. And that's because she plans to be a family caregiver. And so one of the strategies that's in our plan right now, which is that master plan for aging, is to help families, the mothers, the fathers, the spouses, the siblings, and friends. We use the word caregiver, we say family caregiver, but many times it might be a family of choice. And so it could be a friend. And the strategy that really that was put forth under the master plan is called caregiving that works. And what they want for caregiving that works, that means that family caregivers will have the support, emotional support, financial support, job support, so that they can care for the person that they want to help. And at the same time, be able to care for themselves, because what do we say when we want to help someone else? I want to be there for my mother. And in order for me to be there for my mother, sometimes we may need some support ourselves. We don't tend to think about it, but we actually do need some support. So with the master plan, the policies that we want to move forward are those policies that help us be part of a family, part of a friendship, support group, and caring group without making us go into debt, without forcing us to choose between food and caring for someone else, between a job and caring for someone else. So the plan looks at several initiatives and strategies. So the first one is called Family, Friends, Caregiving Support. And that means that we would have, caregivers would have the needed supports like paid family leave, multilingual training resources, virtual care options, and respite, meaning being able to take a break so that you can remain kind of less stressed while you're caregiving and really enjoy the rewards of being able to keep that promise that I'm going to help my mother, my father, my sister when they become ill, or allowing someone to help you when you're not feeling well. And of course, this is part of our long-term care system. The other part under here, the next part of the strategy is that we also know that as our families shrink and we may not have a family member or a close friend to help us, we need caregivers that can come in who are paid, and they need to be able to make a living. So we want caregiving jobs that are can be reimbursed and paid so that people can take pride in being a caregiver, and you can go into that as a profession. So we really want a workforce that can grow, that's trained, and can be there to help as when we don't have friends or family to care for us. The third thing is that we do want to be able to, as the pandemic has shown us, that we need to be able to have access to things virtually, ways of getting training and education and getting information and linking together. So we want some of that care that can be available virtually, being able to have monitors in the house so that maybe when you are a long distance caregiver, meaning, you can't get there and it's usually maybe even 10 miles away, you can have a way of monitoring somebody and feeling more confident that there's another way to look in on the person you're caring for. So those were some of the key initiatives that came out under the Caregiving That Works. And within that, right now, in California, we have been fortunate to have a caregiving system that covers all of California, called the California Caregiver Resource Centers. And they have, for the last 35 years, provided comprehensive services to family caregivers with education, training, support, case management, support groups. But one of the things is, over time, you have to change. And so like with the pandemic, we need to add virtual options so that people can get the education and the trainings and be able to have different ways of accessing the information that they need. And actually, besides accessing it, you want to have it in different languages, and you want to make sure that the person who's talking to you one-on-one really understands you and your culture. So one of the things that's being asked for, and that when we're talking about advocacy right now, our caregiver resource centers have what's called a budget ask. So it's not a bill, but it is being championed by Assembly Member Nazarian. And that bill is asking for us to continue with a pilot, to expand the pilot for digital expansion and services for the caregiver resource centers, and to develop a language and diversity core and inclusion core that would allow us to better access and allow other people to get to the caregiver resource centers. No matter where you live, no matter your language, your cultural background, there will be somebody available to you to talk to you. And so one of the things that we're asking is that we need to let our legislators know that caregivers need support in all languages, and they need to be able to access that support by phone, by laptop, by text messaging, all of those platforms, and that we need funding to do that. And so that is where we are looking at helping that caregiving that works. There are other very good bills under caregiving, and we'll talk about those later. Thank you.
Thank you so much, Donna. Clearly, there's a growing number of individuals becoming family caregivers or just caregivers of people that, family and friends and others. And so this is a critically important issue. And thank you for your remarks, and we'll have the opportunity to perhaps ask some questions within to that regard. I also, just for the sake of time, folks, I think I'm going to ask for our own well-being and caring for ourselves. We're going to skip the break, but please feel free to just stand and stretch while the program continues. No, there's no reason why you just can't take your own break and just kind of listen as we keep going. So with that, I want to I'll introduce Janny Castillo with St. Mary's Center. And she's going to be talking to us about another critically important goal, which is affording aging. It's becoming incredibly difficult to do so with cost of living and everything else impacting California, not to mention, of course, COVID-19. But with that, I'd like to introduce to you, Janny Castillo.
Hello, thank you, Rigo. Can you guys hear me okay? Perfect, perfect. So of course, I want to thank CARA and Jodi Reid for making this space available to us. I believe the conversation is starting today. I also want to do a shout out to St. Mary's Senior Advocates and our personal CARA representative, Judy Jackson. So affording aging, goal 5. It's about we will have economic security for as long as we live. But what does economic security mean? It means different things to different people. For far too few seniors, economic security means to live comfortably without worry. For far too few seniors, economic security means that we can choose where we live, how we live, where we go, and how we get there, whether we want to work or not to work, whether we can financially help our children and our grandchildren or not. For far too few, economic security means freedom. So of course, goal number 5 of the MPA is affording aging. So in my 20 years as a service provider, I have known many seniors and families who live in poverty in a constant state of economic and physical distress. They depend on a system of care that is overburdened and underfunded. Allow me to tell you a story about a senior who I will call Miss Whitmore. This story is true, but I have changed her name to protect her. Miss Whitmore lived in a tent in a park 3 blocks from St. Mary's Center. For those of you who are not aware, before COVID, St. Mary's Center had a drop-in center that serves extremely low-income housed and unhoused seniors. As soon as it is safe for medically vulnerable seniors to come back, we hope to open again. Almost every morning, Miss Whitmore would come in looking tired and weak from sleeping outside in the cold. She enrolled in our homeless services department, where we worked with her for several months to secure a room in our transitional house. But when we finally had a room, she declined it. She told us she was the sole provider of a disabled and mentally challenged woman who lived beside her in the park. And Miss Whitmore was her caretaker and her only source of food and basic necessities. Miss Whitmore was providing economic and emotional security for her friend to the detriment of her personal survivor. Seniors like Miss Whitmore are often labeled service resistant. The greater truth is that we, the community, do not provide adequate economic security for low-income seniors and disabled people as they age. Building on Miss Brandi's story about her parents, many extremely low-income seniors work most their lives in minimum wage jobs as restaurant, retail, and hotel workers. And building on what Miss Donna said, you may also be surprised at how many caretakers for elderly relatives and friends there are. As many of you know, seniors on SSI earn less than $900 a month. This is the population that end up living outside homeless. So goal number 5 is affordable aging, and it has 3 strategies. And the first one is very close to my heart. It's about ending homelessness for older adults. So after helping her friend find a better location, Miss Whitmore did take the transitional housing unit. And because she had an affordable home, access to free food, access to resources, she was economically secure. It showed in the way she walked into the center. She looked rested and happy and so secure that she looked comfortable enough to go on a field trip with other seniors to Muir Woods. I got a little photo I'm gonna share for a second. This is her. So this field trip was transformative because she was able to enjoy the outdoors. Now get me, because this is really important, without having to live outdoors. So that's how important it was to her. But transitional housing was a temporary situation for her. And though she applied for many subsidized units, she died before her name came up on the list. And I have seen firsthand the toll that homelessness takes on a person's health. And I have seen how economic security and a home can reverse that damage if it is not too great. That is why we need, as Governor Newsom said in his opening letter, to make MPA a living document, and we can make this happen. Implementing Strategy A, ending homelessness for seniors, and building on the success of Home Key, which is a $600 million grant made available to cities, counties, and other local entities to purchase and rehabilitating housing like hotels, motels, vacant apartment buildings, and other buildings, and convert them into temporary, permanent, long-term housing. If done right, it will end homelessness for an individual permanently. So for the sake of time, let me talk about the second and third strategy together. B is demand income security as we age, and C is protect seniors from poverty and hunger. So the next story I will share is our story. It is a story of a large, diverse, multi-generational, multicultural group of organizations and individuals, many of whom are right here in the Zoom room, who fought a multi-year struggle to increase quality of life, specifically economic security for California's SSI recipients. You guys probably remember this because it was huge. In the summer of 2019, SSI recipients, the only population that was not allowed to get food stamps, received them. And this was really important because during the 2020 pandemic, when extra food stamps were given to CalFresh recipients to address hunger, when poor people were cut off from their food stamps and supplemental programs, they also received that extra support. So it was wonderful. We used our people power again this year when we advocated to include SSI recipients in California's Golden State $600 stimulus. So let's give it up because we really did a really good job on this. But of course, the fight is far from over. Let me end by mentioning two bills to advocate for two bills. One is Senator Wiener's AB 107, which will reduce barriers and simplify the CalFresh application enrollment process. It will allow people to apply over the phone. And you know, a lot of our seniors still have trouble with internet access and learning how to do computers and devices. And there are many that are not comfortable with technology. So this is an incredibly important bill. This bill, it's on its way to its third reading. So let's make some noise and get into good trouble for California seniors. The other one, which I know everybody here knows about, Assemblymember Luis Rivas AB 71, which calls for California to invest $2.4 billion annually. Let me say that again, $2.4 billion annually in new funding and solutions for homelessness. So look in the chat. I'm going to post some information about both of these bills so that we can all be part of getting them passed. Thank you for allowing me to speak to you. I urge you to use the Master Plan for Aging as a powerful advocacy tool and a door, not the destination, as Patti shared. Let it become the lens and vehicle to help our seniors overcome poverty and thrive. I will stand with you. Who will stand with me? Back to you, Rigo.
Thank you, Janny. I will stand with you. How's that? And I'm sure that many of these folks, if not all, will too. And thank you for really putting a face to the issue and really bringing that human story, real human story and impact to all of us. Again, it's a great way to sort of end the conversation of the 5 bold goals with a real, story, and reminds us of why we have created this master plan for aging under the leadership of Governor Newsom and Kim McCoy-Wade at Department of Aging and others, and Secretary Gailey at HHS and others, and including you, Janny, who was part of the Stakeholder Advisory Committee. And thank you. Thank you for your tremendous words and presentation. We're going to move forward. I'm sure we're going to have other questions, and I want to be respectful of everybody's time. We have about another 15 minutes to go for this program, and so there might be some time for a couple of questions. But I want to also ask Susan, who's going to lead this process for us, to share, because obviously we may not get to all questions. In fact, we just might be able to get to a couple. Where the folks on this, forum, in this forum today, can follow up, if that's possible, to provide some of that information. With that, I'm going to turn it over to Susan Meyer with CARA. Susan?
Hello, everybody. So we only have a short time to take questions and answers. So if you look at the very bottom of your screen, you will see reactions. And if you click on reactions, you have the ability to raise your hand. So we're going to take questions in order of those who have raised their hand. Now, if you're on the telephone, you can press *9. So first up, we have Bobby Moss. Would you please unmute?
I'm trying.
You're good.
Okay, very quickly. I'm a behavioral health counselor and also a case manager. One of my experiences is that as people age and they end up in the hospital and they're discharged and they have a social worker or a case manager discharging them, they will sometimes try to set up IHSS. And the biggest single problem I see is that there are simply not enough competent IHSS workers. Aaron Ekholm would disagree with me, but believe me, I've been over the list dozens of times, and we don't have enough people to service the people that have already been designated IHSS hours. And the other thing is the case managers do not have time to ever follow up on them again once they get them an IHSS worker. And we need case managers to keep following up on these elderly people who are in these situations aren't getting benefits. What if any of these initiatives are designed to be able to help that situation? It's to Donna or anybody who wants to answer.
Okay, well, I would say under the Caregiving That Works initiative, part of the goal of that initiative is really to have these caregiving jobs that are created so that people can get trained, be better trained, have more, I agree with you, you have to have that supervision, but part of you have to have dignity when you work. And the reason that we have a difficult list and people turn over and they're not there is, I think, because they're not trained, it's not paid well, and we really have to have more respect for the importance of those jobs. So I think the initiative that's called Good Caregiving Job Creation is something that we can continue to advocate for, and not just advocate, but continue to look at what bills are actually going to be supporting that initiative. It's an excellent point that you brought up, Mr. How do I say your last name?
Muskie. Yeah.
Muskie.
Yeah. Let me just tell you that I got my IHSS clients certified in 3 weeks, and it took me 3 months to get them a good IHSS worker. So yeah, there you go. So right, we can lobby who? Who can we lobby?
Okay, I'm going to turn this over to probably, obviously we started our local level with our, your local Somebody help me out here.
Assembly and Senator.
Thank you, Assembly and Senators. And just say, look, we have this in the master plan. What are you doing about this? What can we do and how can I help?
Thank you so much. I don't want to take up any more time.
Okay, and we're going to actually have some, as the next part comes up, I know that we're having lobby day, so this is something you should join.
The next speaker that has her hand raised is Susan Hammer. Susan, if you could unmute.
Okay, thank you. I saw this question. I actually have two, hopefully very quick questions. The first one is, can you please define initiative and the difference between an initiative and, say, a bill that's been introduced? And the second question would also be for Ms. Benton. Is it possible in terms of caregiving to have some type of cost sharing? Say you can afford a certain amount, but not over that amount. Would the state or whoever then, could there be some type of cost sharing? Thank you.
This is Jodi. I'm going to answer the second part. That part of what Brandi Wolf from SEIU 2015 talked about in creating a long-term care or long-term support services benefit is to look at financing options. So, you know, what kind of cost sharing could we set up? There is some cost sharing already as part of the IHSS system. There is a way to do that, but even with that, some people are just over income and don't qualify for that, for even that. So part of financing a benefit that more people can take advantage of is looking at all the options. What do we pay for? At what level do we offer an opportunity to cost share? That's all part of figuring this out. So the bill that Brandi talked about is setting the framework for us to be able to have those conversations.
And our next hand raised is Willie Stevens.
Oh, this is for Janny Castillo. Janny, is it correct? I've heard that Senator Grayson, who is head of the Finance Committee, which AB 71, which is permanent funding for services and stuff, the vote comes up in his committee on April 5th, and I hear that he said that he's not going to support AB 71. So I think, I don't know, maybe you can elaborate on it a little bit, but maybe we should really contact Senator Grayson and try to convince him to do otherwise.
Really, you are right on and on task, because I have his information in the chat, and you are right. He is leaning towards no, but that doesn't mean without a push from the public that we can't change his mind. And it is a critical and important vote. So please check in the chat and get his contact information. Let's all give him some calls of why he has to vote yes. Thank you, Willie.
Thank you.
And we have time for just one more question. So if you have not been able to ask your question, you have a question that you want to get answered, in the chat, we will put up an email. You can contact CARA, California Alliance for Retired Americans, or you can contact St. Barnabas Senior Services. So our last question, and the next hand that's up, is Michelle Krug. Michelle, can you unmute, please?
Okay, got it. Thank you. Thank you very much for the presentation. My vision is limited, and I was just hoping before we end that you would go over the 5 goals and maybe give me that bill number for the Cal Fresh so that I can help advocate for that. Thank you.
Thank you for that question, Michelle. Perhaps at this point, that's an excellent place to maybe do a segue and introduce Jodi Reid, my esteemed colleague and leader of CARA, and she could maybe, as part of her closing remarks, touch on the answering that question, and then take us from there. Jodi, I think this is a great place to hand it over to you and kind of share, to share your thoughts of how we could all engage and really, play an active role in implementing this plan successfully now and in the years to come, starting off with the, touching again on the 5 goals, et cetera.
Hi, everyone. Thank you all so much for being here today. This is a lot of information, and we really just sort of touched on some of the topics and the initiatives and the actual bills and budget asks that are part of the 5 goals, which again are housing for all ages and stages, inclusion and equity, health reimagined, caregiving that works, and affording aging. These are the 5 goals that were put into the governor's master plan for aging. The stakeholder advisory group had slightly different categories, but all of the recommendations fall into one of these ginormous goal areas. And many of our esteemed speakers mentioned the importance of picking those issues that really touch you and figuring out how to engage with us, with St. Barnabas, with many of the organizations represented on this call today, with your own communities, with your own elected officials. The Master Plan on Aging is a really beautiful document. If any of you have gone online to see it, it's got beautiful pictures and it's laid out really, really well. And it has amazing content that is kind of overwhelming, to be quite honest. But it's a document. It's a plan. It's a 10-year plan. And a lot of people put their time and sweat and effort into developing the recommendations and encouraging the governor and his administration to include those recommendations in his final report that was released in January. But none of those things will happen unless we make them happen. That's how this works. We've had previous plans. They weren't called the Master Plan for Aging necessarily, but there's been broad efforts to try and look forward and how we deal with our changing demographics. But the things that actually become real are the ones that we make real. And so the part of this conversation today that I want to talk to all of you about is thinking about how to make some of these recommendations, whether they're a bill or an ask in the actual budget, a reality. And it's now about people power. This is what it's about, because this is a political effort in the end that requires the legislature to act. It requires the governor to act, and we elect those people. We're their employers, if you will. And so we need to tell them what we want them to do and how we want to focus our state's dollars, how we want to make policy, how we want to go forward. And so what we're hoping today is that you all will take the next step with us. We're not asking you to do this alone. We are stronger together. And so number one, if you registered for this event, which obviously you did, we're going to follow up by sending you a copy of this recording so you can share it with others. We're going to send you a one-page description of the specific bills or budget asks that were highlighted. They're not the only things that are happening that will take the master plan to a next level and begin to start implementing the recommendations. They're examples of things that will help us. And we will give you the opportunity to take the next step with us. And so one of the things I want to invite all of you to join us in doing is that CARA, the California Alliance for Retired Americans, hosts an annual lobby day. And right now, this lobby day is virtual. because we're not able to meet with our elected officials even in their local offices due to COVID. Hopefully that's going to start changing over time, but it hasn't changed yet. So we are holding 120, hopefully, virtual meetings with the 80 assembly members and the 40 state senators on May 21st. And if you would like to be part of a team that meets with your local legislator, even if you don't know who they are right now, we'll hook you up with the team and the folks who are going to your local legislator. You can sign up to join us. It's May 21st. All these meetings are happening. You can call in to be a part of them or come on Zoom. And you go to CARA Lobby. So you spell it CARALOBBY @gmail.com, and just let us know that you'd like to join. And you'll be able to do that. To prepare us for May 21st, where we all show up and let our elected officials know what we want in the budget, what bills we want to move forward. We won't be able to talk about every single thing, but we need to show them that we are together, that we are organized. And on May 21st, we're going to focus on a few of these, but it's just an example of many more things that we want to work with our elected officials to make real, and not have this document be a beautiful pamphlet or stack of pages that don't mean anything. This is about making it real, implementing the things that we all fought to include in the master plan for aging that are possible this year and in the many years to come. So to prepare you for May 21st, we're going to have another Zoom meeting like this by phone and by Zoom on the week before, on May 14th at noon, just like today, where we will talk through the specific asks that we will make on May 21st when we meet with our legislators. And then finally, if you've never done this before and you want to learn how to do it and feel a little bit more comfortable talking to an elected official about something you care about, we're having a special training on April 23rd, another Friday at noon, on how to communicate with elected officials. And it's a little even trickier now that we're on Zoom, because we're not going directly to their office, but we'll get to see them like we saw Senator Durazo today on Zoom with us. So you can sign up to learn how to do it, then come and learn about the specific bills we're going to focus on, and then join us in one of the teams with other people, other seniors, and people with disabilities in your own communities to meet with your elected officials or their staff people. So there's a flyer that's up here on the screen. It was attached to the reminder email that you all got today. And of course, you can always contact us if you want more information. But I just want to say, the fact that we had close to 300 people with us today, a few more who registered, and that you all took the time to hear about this is the first step to making this a reality. We are a huge population in California. You all know the stories. You have the stories of why these initiatives are so important. We need to hear those stories. As Janny shared with us about the client that she worked with, those stories are so impactful. Your experience is what could make or break a legislator's decision to support one of these initiatives. We have the statistics, we have the policy, we have the backup, from some of our colleagues to show why these bills are important and how they would work. But there is nothing as powerful as your own story about why these issues are so important. And we are trying to capture those stories and really influence our elected officials. The time is now. We have this huge opportunity with some focus on aging issues for the first time in a very long time, where we've all come together to form this master plan on aging, but it won't happen unless we stand united. And together we can do this. Si se puede. And we urge you all to join in whatever way you can. And I just want to thank you from CARA and and thank our colleagues at St. Barnabas for co-sponsoring this incredible event. But really, I want to thank all of you for being here, for taking the time to learn about the master plan, and hopefully for engaging with us as we take the next step to make this a reality. Thank you all.
Thank you, Jodi.
Thank you, Jodi. Very good.
Thank you. So on that note, I just want to say, si se puede, Jodi, absolutely. Yes, we can. Together, united, we will succeed. Divided, we fail. So let's unite. Let's bring our voices together. Let's act together and create this movement. Let's keep it going. And so again, it's been a pleasure on behalf of CARA and St. Barnabas Senior Services. We want to thank our speakers, our interpreters, our staff, our beloved staff, and especially you who make a difference. So unite, come together, and participate in the Advocacy Day on May 21st. Also, as a reminder, if you have any questions, CARA general email for questions is contact us .cara2017@gmail.com. And for St. Barnabas Senior Services, email GU, that's GYOO @sbssla.org. All right, our work has only begun. So here we go. And to get this rhythm going and to keep the momentum moving and going, let's go on and leave and depart with the Macarena.